When it comes to dealing with aches and pains, you may think you have to decide between chiropractic care or physical therapy. That's not the case at Tulsa Spine and Rehab. They offer both. Ryan Smith is a board-certified orthopedic specialist on staff at Tulsa Spine and Rehab. Ryan, 2014 has been an expansive year for Tulsa Spine and Rehab when it comes to physical therapy, hasn't it?
It has. We've had a really exciting year that we're proud of. Started out early with expansion into our new space. We really got that going at the beginning of 2014. We made the move at the end of 2013. We're now in double the space that we had before, so we've got a much larger facility, and as a result, quite a bit of new pieces of equipment, including the AlterG anti-gravity treadmill, which is a great device that allows us to instantly take a lot of weight off of you, take away your pain. Patients love it. We also have some other cool devices called an Impulse eccentric loading device. It's great for shoulders. We've also added cold laser, which has been a really great adjunct for a lot of our folks. And then on top of that, we've added some new providers, and we've also added some new service lines.
So explain the process. If someone comes in with a specific complaint or problem, how do you all decide the course of treatment and who they need to go see within the clinic?
That's a great question. A lot of the referrals that will come in are from a specific referral source who wants this particular patient to see a particular provider. And we'll start out that way, but oftentimes, as an example, Dr. Riley might see somebody, and they come in with neck pain. And in the course of their evaluation or the course of their care, they're also complaining of, hey, I've also got right shoulder pain. It's been bothering me for a long time. I just haven't said anything. And then I'll take a quick look at them and determine if that's something that, in fact, I can get involved in and help, or somebody that's on our team. And it's a great way for clients not to have to go to a variety of different places to get something handled, because often, injuries aren't in isolation. There's often more than one component. And so each of us, we try to get folks positioned with the right provider based on the complaint that they have, because we can't treat everything. We all have our specialties, and we all know our boundaries. And I think that's why the team works really, really well together. And we get great outcomes for our clients.
You don't necessarily need a referral, though, to visit, correct?
No, and that's what's great. There's actually a new law in the state of Oklahoma for physical therapists that started in November, that you no longer need a referral to see a physical therapist. And that's been a huge deal for us. We've wanted that for a long time. Everybody that comes out now has a doctorate. It's actually something I'm going back and doing, going back and getting my doctorate now. And on that note, we actually have a new physical therapist who started. Her name is Megan Warner. She got her doctorate at OU. And she came on staff with us a few months ago, and she's got a special interest in women's health and pelvic rehabilitation. And that means all the issues related to pain, primarily with females, but we see it in a lot of men too. There's some special issues that go on in the low back and in the pelvic region as we age, and there's a lot of really amazing new things coming out that really helps folks in that area. So she's got a special interest in that. And then the other thing I wanted to mention as well was all the work that we're doing in the community in concussion management. So Holly Thompson, who heads up our balance and vestibular and concussion program, who has a specialty in that as a physical therapist, we've partnered up with OU Sports Medicine with Dr. Tommy Kern and Lamont Kavanaugh, and we are now doing screening for many of the youth sports in the city preseason, so that if somebody has a concussion event, we've now got baseline data for them. And if they do have enough of a change after they hit their head, then we will end up working with that particular patient and help them know when it's safe for them to go back. And we're also doing that with the University of Tulsa football team and all of their other sports. And it's been a great relationship, and there's so much neat new information coming out in this realm, and people are becoming more aware of how serious it is, and we've been really proud of that program.
You think people have a general understanding of the treatment that is available through physical therapy?
No, I don't, and I think some of that is because we're in so many different domains, and I think what the team that we're trying to put together here is we're not, each of us aren't generalists. We don't do everything. I'm trying to help people understand that we have people who specialize in orthopedics like myself, so sprains, strains, fractures, surgeries, joint injuries, and then we have people who handle vestibular, balance, and concussion problems like Holly, and then Megan, who deals more with pelvic health and pelvic rehabilitation and women's health issues. And I think that's the thing, is that there's so many different things that we can help people with, and we're trying to put all that under one roof so it makes it more convenient for the patient.
Your options aren't limited when it comes to treating your aches and pains. At Tulsa Spine and Rehab, you can get the most advanced physical therapy or chiropractic care. Give them a call to find out how they can help you. 918-743-3737.